Thank you for joining me today into our next topic, Classical or Experiential Formulary Doctrine, commonly known as in Chinese, Jing Fang Xue. This is one of the course within the program of overview of TCM Classics and Doctrine. The earliest documentation, and this is all about herbal medicine, the earliest documentation of the herbal formulations was first described in a book of Han. The book of Han is written by Ban Gu. It's a historical document of the West Han Dynasty from 202 BC to about 23 AD. Now, Han Dynasty is consisted of two main separate dynasties of West Han and East Han dynasties. And if you combine them together, they last about 422 years. So it's a pretty long dynasty. And because of this stability of the 422 years, after many, many years of warlording during the Spring, Autumn, and Warring State era of the Zhou dynasty, as well as the brutal unification of the Qin dynasty, which only lasts about 30-some odd years, this stability of 422 years really improves the cultural growth in all areas, and not the least, also traditional Chinese medicine. So it improves the documentation and advancement of medicine, where that we see the creation of TCM classics, such as Shanghan Zabing Lun, which is a major Bible of therapies in traditional Chinese medicine. And there are others too, but unfortunately, most of other ones are lost. So when they're lost, it doesn't necessarily mean that they are no good. They might be classic alone on their own, or they may be just something that is not as profound or is not as useful, and then they somehow disappears. But regardless, you need to know that Shanghan Zabing Lun is not the only classics that appears in the Han Dynasty. So in the book of Han, this historical documentation, when you talk about Jingfang, this is how it states. It says that there are around 11 formulary books spanning about 274 chapters at that time. And formulary originates really from cold and warmth of herbs, detects the severity of the disease, borrow the nourishing effect of the herbs, sensing the qi that differentiates the taste, to cause the alignment of water and fire, to relieve bowel and stasis, and not the least to bring back to balance. So in some ways, in the early statement of what herbal formulations does, it already says about not only to treat diseases, but really is to bring back our body into some sort of balance. Now, there's a lot of loss of these Jingfang books. Unfortunately, it states that most of these 11 publications has been lost through time. And the only one with collections of formulas around that time has been able to pass down was Shanghan Zabing Lun. And amazingly, it's a good one. There's a theory that the herbal formula in these 11 publications were primitive and not as effective, hence of the reason of their disappearance. Now, I cannot tell you that, but there's a theory that's floating around. That's the reason why these so-called 11 classics never really got passed down. So, what is Jingfang? So the earliest first definition of Jingfang is that these are mostly a combination of herbs, mostly two or more herbs in one formula. Obviously, a formula can be made of one herb. It's out there. And there are certain formulas that just uses one herb. But this is more of a minority and then a majority. Majority is plural of herbs, numerous herbs combined together. They are known combination that are used to treat diseases somewhat effectively. Therefore, Jingfang is defined as experiential formulas, formula that has known through experience that works in the Book of Han. Even though this was defined, the Book of Han did not provide the actual formulations themselves. It just provides a historical document to confirm that such formula books exist and what the formula is used for. Now, the very first comprehensive herbal formula book has to be Shanghan Zabing Lun. If you look at Huang Jing, it's only got about 13 formulas in there. It's very little. It's more theoretical foundation book. But when you get to Shanghan Zabing Lun, this is an amazing book that is not just dealing with herbal formulas, but it actually has frameworks on how to evaluate, differentiate, diagnose diseases so that you can appropriately classify disease in different stages, or what we call different channels, differentiation, so you can give proper herbal formulas for them. So there are other formula books before Shanghan Lun, again, mostly lost, mostly lack of ethiopathology framework, and mostly primitive, and the use is poorly documented. Shanghan Zabing Lun is a combination of two books written by Dr. Zhang Zhongjing. One is Shanghan Lun itself, and the second is Jingwei Yao Lue. Now, Shanghan Lun is the discussion of cold injury diseases, and it's a book demonstrating herbal therapy via the 6-channel differentiation, and it has listed around 112 formulas. Truth to be told, that this book became later on a whole school of thought of cold injury diseases. We call it Shanghan Xue Pai. And that is something we will discuss in the future lectures. Now, Jingwei Yao Lue is also part of this book. It's essentials, and the name of Jingwei Yao Lue means the essentials from the Golden Cabinet. It's a book that focuses on herbal therapies for condition that is non-infectious, or we call it miscellaneous disease. You must understand at that time what is the most difficult disease, or the disease that kills people are infectious diseases. We don't have good antibiotics. At that time, we don't have all the major herbs that can be used for infection at that time. So people died of infection very easily in the old days. Therefore, the main therapy is the treatment of these infectious diseases. That's why Shanghan Lun is so popular at that time, and even today. Now, Jingwei Yao Lue is a book that treats the miscellaneous disease, or sometimes what we call the other than disease caused by injuries. And it's listed about 262 formulas. So quite a bit of formulas. It tell you right off the back already that infectious disease is so very important to treat, but miscellaneous diseases is this whole big category outside of the infection diseases, and this category can be quite huge. And Jingwei Yao Lue attempts to solve some of these non-infectious disease problems. So, Shanghan Zabing Lun are the first comprehensive herbal therapy publication that has clearly defined diagnostic stages. Therefore, they are also considered to be classics. They are classics of formulary doctrines. Any good students who believe in the importance of studying of herbal formulas must study this book. This book is considered to be the Bible, or the fathers of all herbal formulary books. Therefore, because of what Dr. Zhang Zhongjing has brought to us, he is therefore revered as the saint or the father of TCM today. And both of these books that he has are now considered to be the classics of TCM in etiology, in pathology, and herbal therapies. So a good Chinese medicine student must study these two books. Now, interesting enough, this book was lost for a time, and that's due to subsequent wartime. After the Han Dynasty, there was a lot of fighting, And with the fighting, with famines, with wars, these two publications were somewhat lost, or it was in private collectors' hands, but it never appeared in the society again at that time. Now, during the Song Dynasty, which is about 960 to about 1279 AD, there was a rise of feverish interest in studying the Shanghan and Jingfang due to the rediscovery of these two books. In fact, Sun Simiao actually republished these books into his Qianjing Huang publication. So that's where we can see some of these former editions of this book. Because of this interest and because of the importance of these two publications, there are now numerous, hundreds of different editions and interpretations of Shanghan as well as Jingfang. Now, there are second definition of Jingfang. Sometimes we call it Jin Fang. The use of these formulas are widely spread and generally accepted. These formulations therefore became the new definition of Jingfang. So it's no longer just experiential formulas, but formulas coming from these two classics. Coming out of these two classics, what we call the classical formulas. So people who want to stay true to TCM, the first thing they tell you is you gotta study these true classical formulas from Shanghan Zabing Lun. Therefore, the study of these classical formulas and its variants become the main focus for Jingfang or Jinlunfang, or we call it Classical Formulary Doctrines. Now, there are further delineations. For example, formula from Shanghan Zabing Lun are Jingfang. Formulas published after Shanghan Zabing Lun are considered to be Shifang, or sometimes we call it contemporary formula. So contemporary formula versus classical formula. Now, in summary, there's really two definitions. The first definition of Jingfang, sometimes we just call it Jin Yan Fang. Jin Yan Fang means experiential formulas. Okay, this is the study of 80 published or non-published herbal formula that has shown efficacy. The second definition is Jingfang again. Sometimes we call it Jin Lun Fang. Jin Lun means classical discussion. So Jin Lun Fang basically means classical discussion formulas from these two books. So the study of any formula from Shanghan Zabing Lun and its variants are considered to be Jin Lun doctrine, Jin Lun Fang doctrine. Now, if we look at publications, there are two main types of published herbal formulas. The very first is direct type. Well, direct type is the one like someone who has created formulas, has worked well, and so these doctors written down some of the experiences they have, the experiential formula they have. For example, Shanghan Zabing Lun is a very good case where Zhongjing wrote some of this formula that he's aware of, that he has created, that has worked really well. So that's a direct type. Then the second type is an indirect type. Well, indirect type is more compilation, or shall we say collection. Let's say the next village over, there's a doctor who does very good work and he passed on, but his formula passed on to us. So we collect these formulas. And then in village B, we have somebody who is the same thing. We collect that formula from village B, village C, village D. So eventually you compile, and we call this an indirect type, compilation of other physicians' formulas, which include also government-sanctioned and private-funded publications. For example, White Type Yao, or what we call the medical secrets of an official. And that's written by Wang Tao. And further, to give you more definition, is that there are three classifications of formulas based on time. So Jingfang, frequently we call that classical formulas. So that's the earliest, most ancient formulas. The next would be Shifang, is contemporary formulas. These are formulas that come after Shanghan Wenbing's formula. And then the third definition is Jingfang. Jingfang means modern formulation. These are mostly 1900s formula to today. Okay, we call them modern formulas. Now, Shanghan is basically defined or translated as discussion of injury by cold. Now, in this book, it describes herbal treatments for exogenous diseases. It is the first book that describes treatments for infectious diseases in the world, actually. It has a great description of all different formulas, and it contains about 112 herbal formulas. Now, 金匮要略, the other book, sometimes we call the synopsis of Golden Chamber, or the medical treasure of the Golden Chamber, or essential strategy of the Golden Cabinet or Golden Box. It describes the herbal treatment for internal medicine mainly, gynecology, obstetrics, and pediatrics. It is the first book that describes treatment for non-infectious miscellaneous diseases. 25 chapters. Chapter 1 is on TCM fundamentals. Chapter 2 to 19 are on internal medicine. Chapter 20, 21, 22 are women's health issues. Chapter 23 is miscellaneous disease. And 24 and 25 are nutritional guidances. Very well thought out, very well laid out book. It contains about 262 herbal formulas. Now, after the publication of Shanghan Zabing Lun in the Han Dynasty, continue forward, there are many, many more compilation and direct work of formulary books. For example, in the 6th Dynasty, which is about 220 to about 589 AD, there's about 150 plus publication on formulary alone. Tang Dynasty, 618 to 907 AD, you're seeing also around 150 plus publications. Song Dynasty, about 960 to 1279 AD. Now you're seeing more, because don't forget, Song Dynasty was the dynasty that the Chinese discovered paper printing. Obviously, all of a sudden, the amount of publication just shoots right up. So at that time, it's about 250 plus different classical publications. Then the compilation publication, where you compile and collect thousands of formulas, there's about 69 plus publications. So we're going to go through some of it. And they're all from various authors. Now, if we can break it down and say, so what are the publications before and during the Tang Dynasty, which is about 618 to 907 AD. So it's around 80 years around that time. Now, there are several of them. For example, Wu Se Bing Fang, that is with 280 formulas. Huang Jing with 12, 13 formulas I discussed earlier. Shanghan Zabing Lun, we talk about 113 to 262. Added up together, you're talking about 375 formulas. Zhou Hou Beiji Fang is written by Hong, which we'll talk about in a moment, has 101 formulas. And then you have the Beiji Qianjing Yao Fang and Beiji Qianjing Yi Fang. That is total combined about 5,300 formulas. It's a profound amount of formulas. By this point, it's becoming more of a reference book, but it's still a very important book to study. And Wai Tai Bi Yao, it's another giant book, and that includes about 6,000 formulas, So let's talk about Zhou Hou Beiji Fang. Zhou Hou Beiji Fang means handbook of prescriptions for emergencies. It's about 101 formulations, mostly singular herbs. I did say earlier that would be a minority. Well, in this situation, in this particular book, is mostly singular herbs. Hong is a thrifty person. He doesn't want people to spend tons of money to treat their own illnesses. So he decided to actually find locally sourced herb that's easy to get and that's cheap enough. So he was able to accomplish that. Now, this book is written around 341 AD by Hong. 8 sections, 72 chapters. And the current edition has been revised by Tao Yunji. And most of the herbal formulas have been used in agricultural communities where people are poverty-driven. The herbs are also cheap, easy to obtain, and quite effective. It also discusses about how these diseases can be contagious and he described the pathology of smallpox as well as TB. Okay, so it's quite advanced compared to the Western medicine counterpart at this point. For example, the formula 葱子汤. 葱子汤 is a combination of 葱白 and 鲜子 for the treatment of exogenous common cold, for example. It's still widely used today. Okay, so let's move forward and let's talk about Ge Hong for a moment. Ge Hong, his Taoist name is Bao Puzi. He was born 283 and he passed away about 343, as far as we can get that documentation. He was a very famous Taoist and physician during the Eastern Jing Dynasty. He's a chemist, he's a doctor, he's a philosopher, and a Taoist, and he is well respected and one of the earliest scientists documented. He is married, a well-known government. Okay, so in that situation, he is wonderfully suited. Oh, by the way, Bao Gu is also a very famous Marxist-Basionist. So obviously, with both of them in this field, they kind of help each other to propel their training and understanding of TCM. Now, this Beiji Fang, it's basically written by him, and it's called a Handbook for Prescriptions for Emergencies. There's 3 sections. First section is about 35 chapters on internal condition and diseases. The second section is 35 chapters on external appearing diseases. And the third section is 31 chapters on external injury diseases. Okay, so if we look at the book and just go to section 6, chapter 16, treating cold heat malaria, on 9.2 of this documentation, it reads that Qing Hao, 1 bunch, immerse in 2 liters of water, wring out and drink the juice. And it is basically the first attempt to make people aware that Qing Hao is used for hepatitis. Qing Hao is used for many different conditions. And so nowadays, Qing Hao is being known as the major herb behind the ingredient artemisinin for malaria. So the Chinese has contributed greatly to the treatment of malaria by identifying the right plant for this kind of condition. Now, Qing Hao was recommended, and Ge Hong was the first person to recommend this herb for the treatment of intermittent fever. And his recommendation is to soak the entire plant in water, not warm water, just cold water. So wring it out, therefore result in the immersion of water, flavonoids and aromatic oils contained in the stem and the leaves. This extraction process is likely to yield artemisinin in a larger quantity than the decoction method, than the cooking method. Now, it was and is directly linked to use in acute episodes of fever, especially malaria. Both artemisinin is the extract isolated effective ingredient in Qing Hao, as well as some flavonoids, and that have anti-malarial properties, as well as synergy. Now, Ge Hong's recommendation to ingest such a juice wrung out of Qing Hao rather than the herb tea and an infusion made of hot water poured on a dry plant directly may be critical in obtaining the effectiveness of this herb in the treatment of malaria. So remember, Qing Hao is not cooked that well. Qing Hao is basically an immersion. Okay, immersion. So let's move on to the next major classic, Beiji Qianjing Yao Huang and Qianjing Yi Fang. Okay, this is a pretty big volume book, it's translated as prescriptions worth 1,000 gold for every emergency, or shortened to be called a Qianjing Fang. It's written by Sun Simiao, another titan in TCM, about 652 AD. Has a collection of approximately 5,300 formulas. So some of it is written by him, but some of it is probably a collection from some other book. And it is written in sections starting from condition of OBGYN, pediatric. As you can see, their mind are very clear that the mother and the children should be the most important people to take care of before the husband. So a lot of times that is what it means there. Now, so it's a big book. It's a pretty nice sized book, and it includes a lot of different therapies. So it's not just limited to herbal therapy. Again, funny thing is that this book, 备急千金药方, was written around 682 AD by Sun Simiao, which at that time he was 90 years old. He wrote this book at 90 years old. Obviously, he probably had some student that helped him. Now, it is and then he wrote a 千金一方, which is what we call the supplement to 千金药方. So on top of the main book itself, there's also a secondary book. And it includes a 30 section, the second book, includes a 30 section, 2,900 formulas. Topics are material, medical, OBGYN, pediatric, Shanghan, preventive dietary guidances, tonification, windstroke, miscellaneous diseases, chemistry, Chuangyong, post-diagnosis, acupuncture, and prohibitions. Okay, so we discuss a lot of different aspects of TCM. Now, another major publication, which is a compilation, is called 外台必要. The author is Wang Dao. He's not a TCM doctor, interesting enough, but he's a scholar. He's a government official, worked in the Imperial Palace Library. This book is written in 752 AD, 40 sections, and collected over 6,000 formulas that existed in Tang and before Tang Dynasty. It also preserved some of the rare writings before Tang Dynasty. So let's take a look at Song Dynasty. Well, during and before the Song Dynasty, which is about 960 to about 1279 AD, we're getting closer to us now. The government actually interfered and got into the publishing business in a sense of publishing something that's easy for people to follow and understand. And but also the collection of the herbal formula, the volume just increased astronomically. For example, typing Shen Hui Fang, it's about 16,834 formulas. Typing Hui Ming He Ji Ji Fang is about 788 formulas. That's actually the smallest one. But imagine if you're studying chem, that's going to be a problem. That's going to be hard to study. And then you have Shen Ji Zong Lun, about 20,000 formulas. You have Yu Yao, Yu Yao Yan Huang, that's about 1,087 formulas. Okay, so you can see that as time goes on, the collection of formulas increases. Okay, got to a point where that's kind of hard to study, which we'll discuss in a moment. Now, Taiping Huiming He Ji Ji Fang is also known as He Ji Fang. The author was Chen Si-wen et al., and it's about born in it was written in about 1078 AD. There's 788 formulations, which is a compilation, highly used and a father of pan herbal formulas. And so example like Chen Tang, Si Jun Zi Tang, Si Wu Tang, a combination of different herbs combined together. Okay, let's take a look at some of the background of this time. During the Song Dynasty, 960 to 1279 AD. This is a period of many invasions from Mongols, meaning wars, severe corruption, and also the invention of printing press and medical schools as standardized patient herbal formula. So at that time, this is the beginning of what we call patternized formulas. So you have, for example, Su He Xiang. That's very good for opening up heart blockages, increase consciousness. For example, Zi Xue Dang. Zi Xue Dang is used for high fever. For example, of Zi Bao Dan, and that's using urogenital area issues. And the herbs tend to be tonics, warm, pungent in nature. That's the nature overall in this situation. Now, let's look at private sector, because some of it is a public sector. And a lot of times we don't know what the private sector holds. Well, a lot of Chinese were generous. They were able to donate it to the local library or donate it to people so they can print it out and read. And so I listed in the chart, in the slides, of basically over 10 different classics, and each one is very effective in their own right. Okay, so you can start with Boji Huang, 7,000 formulas. Shen Si Liang Huang, you can go to Ji Feng Pu Ji, 3,000 formulas. Okay. And then you can look at all the different other ones that comes afterwards. There is the Ben Si, Pu Ji Ben Si Huang, 366. There's the San Yin Ji Yi Bin Zhen Huang, which is about 1,500 formulas. There's Yi Jian Huang, it's about 150 formulas. There is the Wu Zai Bei Yi Xuan Fang, there's about 1,000 formulas. There is Ji Shen Fang. There is Xuan Ming Ren Fang. There is Dongyuan Si Xiao Fang. So that's about 200 formulas. Then there is the Si Yi De Jiu, about 3,000 formulas. So you can see they are becoming a lot of formulas. They're in the thousands. And when you start to get into the thousands, it gets kind of hard to learn from them, hard to read them. They become more of a reference book. And this happens continue onward. If you look at during the Ming and Qing Dynasty, which is about 1368 to 1911 AD, you're starting to see formula book that is basically unruly, too big. Let's take a look at Pu Ji Fang. Pu Ji Huang, the book fills, there's several sections. That book fills my whole entire bookshelf. Okay, it listed 61,739 different herbal formulas. Think about that for a moment. That's daunting. That's hard to even learn all of them. And you try not to learn all of them. You try to learn what's effective in your clinical setting. And the next formula is a Ji Xiao Liang Huang, which is about 7,000 formulas. Yi Huang Kao is about 700 formulas. Wan Bing Hui Chun is about 190 formulas. Zhen Zi Zun Shen Lei Fang is about 2,927 25 formulas. Okay, and then you have Zhen Zi Zun Shen Lei Fang, about 2,900 formulas. And Zhu Ji is about 74 formulas, and the Gu Ji Ming Fang is about 150 formulas. So you see some small ones and then some really, really large compilation books. Yi Huang Ji Jie is 380 books. Tang Tou Ge Ju is about 200 formulas, and on and on. So you can see that there are small ones and there's also large compilations. So if we look at 1911 AD onward, then we are starting to see the books that is quite useful. And the very first one is Yi Xue Zhongjing Can Xi Lu, which is an integrated Chinese and Western medicine book that provides us some of the very useful formulas, about 167 of them. Now, the next ones are, for example, Zhongyi Fangji Da Cidian. This is the dictionary of TCM herbal medicine. The entries are about 96,592 formulas. When you get to this level, these are not the book that you learn about framework. These are books you learn about herbal formulas. These are now reference books. These are now dictionaries. Onward, you can have Li Dai Min Yi Liang Fang Zhu Yi, 2,000 formulas. You can Zhong Yi Lei Huang Ci Dian, 2,540 formulas. You could have Chinese research, TCM research, modern research formulation. That's about 800 of them. You could have 中国现代名医验荒会海. That's about 10,000 formulas, for example. And outside of China, you can see Yi Xinhuan in Japan, published in 982 AD. You can see Yi Fang Lei Ji in Korea, published about 1445 AD, and that's about 50,000 formulas. You could be looking at Dong Yi Baojian in Korea, And then you can also look at 临床应用汉方处方解说 and that it's about published in Japan 1966 AD and lasted about 366 formulas, 366 formulas. Okay, so just give you a rundown of the enormous volumes of formulas that you can access to. So we are not lack of formulas. Obviously, having them translated would be very helpful, but we are not lacking formulas. Okay, now, knowing that, we need to take a look at what are the 10 most popular formulas used today. These are Xiao San, these are 血虎逐一汤、五苓散、桂皮汤、小青龙丸、小青龙汤、六味地黄丸、小柴胡汤、大承气汤、温胆汤 and none of these 补中益气汤. Okay, these are the 10 top formulas. And they come from different classics. For example, Xiao San comes from the 惠民和剂局方, 太平惠民和剂局方. 血虎逐一汤 comes from 医林改错, written by Wang Qinren, fabulous book. And then 五苓散 comes from Shanghan Zabing Lun, written by Zhang Zhongjing, for example. Onward, now that these 补中益气汤 is written in the Pi Wei doctrine. It's in a school of thought doctrine. And so he's attending some of these, basically some of these formulas are so powerful and so useful today. They are commonly used throughout all the patent formula. These are very easy. These are all in pill form, capsule form, and you can just buy it over the counter, and then you can use them for various different diseases. So again, 逍遥散、血虎逐一、五苓散、桂皮、小青龙、六味地黄、小柴胡、大承气、温胆汤 and 补中益气. Okay, these are some of the formulas that we see. Let's take a look at 逍遥散. We'll just go through two examples so that you kind of have an idea of some of the patent herbal formula put together. This 逍遥散is very widely used. 逍遥散, as we translate, it means freedom powder. Freedom from what? Well, freedom from liver stasis, freedom from emotional trauma and congestions, freedom from pain. And this first appear in Taiping, Huiming, Heju, Juhuang. In the formula, the herbs are 柴胡、当归、白芍, 白术、茯苓、甘草、薄荷, and 生姜. And it's used for liver qi stasis with blood deficiency, causing hypochondriac pains on both sides, alternating fever and chill, headaches, vertigo, dry mouth, throat, fatigue and poor appetite, irregular menstruations, breast tenderness and distending pain, and when you have wiry pulse but deficient pulse. So that is 逍遥散. It originates, if you look carefully, it really originates from the modification of combination of two formulas, 四逆散 and 当归芍药散. Both are from classics. Okay, 四逆散 is from Shanghan Zabing Lun, is made of 甘草、枳实、柴胡、芍药. And then you have 当归芍药散, which is come from 金匮要略, 当归、芍药、川芎、茯苓、泽泻, as well as 白术. Combination of these creates 逍遥散. So a lot of times, what people say into the future is that, well, majority of formulas are built from Shanghan Zabing Lun. So therefore, a real true student of formulary doctrine is really to study the classics, to study these classical formulations. And that is true to a certain degree. The majority of formula, you can find roots there. But there are going to be some formulas that is not from classical formulas. We call these non-classical formulas. And they are equally as experienced effectively. So therefore, it's important to understand that the doctrine doesn't necessarily just mean classical. You must also study non-classical formulas. So we know, for example, 四逆散 was used for Shaoyin disease, while 当归芍药 is for gynecological problems. When you combine together, is very nicely used for liver stasis with blood deficiency situation. Now, current use of this formula, I mean, if you think this formula was designed so many years ago, what can you use for the current disease? Oh my God, it can be used for so many different things. And if you look at research of Xiao, it's been known to be effective and helpful in viral hepatitis, hepatic cirrhosis, cholecystitis, anxiety, depression, mood disorders, impotence, menopausal symptoms, chronic PIDs, fibrocystic breast disease, optic neuritis, optic neuropathy, hyperpigmentation, acne, etc. So there's a lot of research of a current use of Xiao San. So an ancient formula that's combined through a classical formula are so useful today for all these different diseases. The next formula, you should know this, Liu Wei Di Huang Wan. It's come out interesting enough. It was really first designed for children, for infants. And it come out of Xiao Yao Zhen Zijue. And the formula is Shou Di Huang, San Zhu Yu, San Yao, Zhe Xie Dan Pi Fu Ling. Okay, these are the what we call the 6 3 tonification herb, 3 not tonifying but sedating herbs combined together give it a 6. This formula is used to nourish in tonify kidney. Okay, so it's used for kidney essence deficiency. People that might have back pain, heel pain, sluggish urination, night sweat, xiaoke, vertigo, ear ringing, ci position large and deficiency. So this is what you can use for. But originally, it was used for kidney essence deficiency in growth retardation in children. Okay, so nowadays you can see it can be used for all variety of conditions, which we'll talk about in a moment. Now, again, this formula is so important. It actually originated from the classics again. It originates from Jingui Senqi Wan. Jingui Senqi Wan is a combination of Di Huang, Sang Zhu Yu, San Yao, Zhe Xie, Fu Ling, Dan Pi, Gui Zhi, and Fu Zhi. So you get rid of Gui Zhi and Fu Zhi, you have the ideal formula. Warms up the kidneys, tonify kidney yang, again, used for back pain, lower trunk and extremity coldness, pelvic pain, sluggish urination, restless heat, and difficulty with sleep. Now, if we look at current use and current research of Liu Wei Di Huang Wan, you will see it's used to treat hypertension. It is used to treat for premature atrial contractions, congestive bronchiectasis, hepatitis B and cirrhosis, atrophic gastritis, DM, diabetes mellitus, renal failures, ITP, idiopathic thrombocytopenic purpura, nephritis, urinary stones, male infertility, benign prostatic hypertrophy, and menopausal disorders. So you can see it's been thoroughly researched on what it can be applied in. So quite a bit of diseases. So at the end, as we're coming to the end, so why do we learn and collect formulas? Well, first of all, not all formulas are used for all diseases. So having a collection of formulas help us to widen the possibility of finding a formula that can work for a particular difficult case. That's number one. Number two, it also helps for us to build a foundation of understanding of how herbs are put together synergistically in a formula. Number three, it improves our clinical outcome by having more arsenals in our disposal. So learning formulas is useful, and not only that, nowadays, some of the formula books are now dictionaries. So they become more of a reference book instead of a straight learning book. So merely collecting herbal formula will not make us a better doctor, but trying to understand how the formula is constructed and how the herbs are put together synergistically will help us to design and create better formulas in other cases. This is where creativity counts. this is where being creative can be really helpful to be a good herbalist. Now, writing down formulas help us to learn better than just thinking about the formula in our head. So being able to copy formulas, being able to highlight some of the formulas in the book really help us to learn. That's number 2. Number 3, knowing deeply the framework of how formulas are constructed by a particular master would be much, much better than knowing not as deeply, but by many, many masters. So sometimes I always say, stay true with the master's work. Okay, if you start with Qianjin Yao Fang, stay true with that for a while. Study that for a while. If you study with Zhang Zhongjing's book, continue with that book for a while. Don't try to jump around too much if it's possible, so that you get a good feel for the train of thought of that particular author, that particular doctor. That would help you to compose your formulas better. Okay, highlighting and knowing the frequency of a particular herb is useful to help us to know the consensus of many different doctors. That's also a very useful thing when we do collection of formulas. Okay, so this ends our talk today, and thank you so much for being with me today. I will see you next time. Bye-bye.